So history taking is one of the most common things that you should know as a medical student. But the problem is it becomes a great headache for us because when we try to go and take history, sometimes we get so many complicated or complex patients that we don't know what to write. When you ask the complaint what brings you here, they will start telling their whole lifeline that I was born this, one cat got died, he due to that I got cough, I fell from there, this, that. So much unrelevant data that has nothing to do with us. But still, everybody teaches us how to take the standard history taking format. But the main thing lies how to segregate it from the real things, because the patient tells so much unnecessary data that we don't know what is true and what is to write and what is not to write. And also in some cases we don't have enough time also to spend hours and hours with the patient, so we need to be quick. I call those type of patient as historians because it's like talking to a nutty historian who keeps going on and on and on about his subject. So it really sucks, I know, I too have been there. So but then I learned some strategies. So here are my advanced strategies to decipher those complex historians. So starting the video, let me introduce myself. I am Nihal Ranjan, a currently final year MBBS student. This is White Coat Talks, where we make videos to help people. So to begin with, the first strategy that you can use is using a chronological anchor. So most of the time the problem that we do as a student or we make as a student, that we get confused in the symptomatic list. We try to analyze each and everything, and due to that we forget what is the important, or sometimes even miss the real thing. So in that situation, the best thing we can do is follow a timeline, follow a chronological order of things. Okay, so you can ask question like, when was the last time you felt good? Okay, or when was the last time that you fell or when was since when you fell ill? So when you will ask question like that, you will get a basic timeline, and that will be your baseline. Using the baseline, you can grow in a chronological order and find all the other symptoms. Okay, so it's like a linear timeline that will help you to know which symptoms started. So if you will use this, you will know that whether vomiting came before headache or fever came before cough. So it will help you, and these things you won't find in symptomatic list. Okay, that is the first strategy. Second strategy is finding the tipping point. Okay, so tipping point in the sense, like there will be many acute or chronic patients. Like if you take COPD patient or the patient who have chronic breathlessness or asthma patient, so they come with the complaint of breathlessness, but it is like they have breathlessness every time whenever they come. It is not that it is new. 2 days back also they have breathlessness, before that also they have breathlessness. So in that condition, if you will write breathlessness, you won't be able to decipher for what reason they have come or what is the real problem they are facing. So in such conditions, you can ask the patient that what is different today than yesterday. Like yesterday also you have breathlessness or before that, but what is the difference that you felt? So in that conditions, they can say that I generally have breathlessness, but today I felt a sudden chest pain or sudden cough or sputum, something like that. So in that conditions, you can make your differential diagnosis accordingly. Like if they tell that we have sudden chest pain, then you can think for whether it is pneumothorax or embolism instead of getting stuck on COPD. Okay, so it will help you a lot. The third strategy that you can use is finding the review operating system, or basically cutting the noise. So this generally happen with the yes patients. Like if you ask them, do you have headache? Yes. Do you have stomach ache? Yes. Do you have bladder ache? Yes. Do you have this ache? Yes. Do you have toe ache? Yes. They'll keep telling yes on everything. It is not that they don't know the problem. The problem is it is due to anxiety or fear, or sometimes also when they are illiterate. So in those conditions they will say yes on everything. So what to do in those conditions? In those conditions, you ask the patient that, I know you have a lot of complaint, but what is the one complaint you want me to solve immediately? When you will ask this question, the patient will tell you that one complaint or one thing that he wants immediately to be solved. Like it will send patient in some emergency mode. Then he will tell you one thing that you can keep as chief complaint, and remaining everything can be written as the associated symptoms. And the fourth and final thing is teach back method. In that, when you ask the questions or when you have completed taking the history from the patient, you summarize the history back to the patient in 3-4 words or 3-4 lines, or as small and as simple English as possible, using the medical logic, not medical terms, logic. Okay, and as simple English as possible. So when you will do that, you can, for example, you can say that, okay, so on yesterday, on 4 days back you started fever, then suddenly you have, then after the next day you have a cough with sputum, and you came here because you are weak to walk. Then you can know whether your order is correct or not. If the patient say that I got cough before fever, then you can change your order accordingly. That time you can know that which one came first, and it will help you to avoid becoming fool in front of the teachers when you are presenting your case. Okay, like these historians generally just fool in front of teachers, that is the thing. And some other strategies that include, like active, you should practice active listening. Okay, you ask the patient to tell the story, but you should be active listening for 2-3 minutes. Then you should also does not interrupt the patient whenever you want, but you should interrupt gently. Okay, like if he is telling, so okay, so do you really feel pain, where you felt, so those things. Okay, and the last strategy is master the basic standard history taking. When you will master the basics, that it will help you to build bricks on the fundamentals. Okay, and the thing that you should absolutely avoid in history taking is you should not interrupt the patient too soon. Okay, because interrupting the patient may lead to causing more problem or changing his statements frequently. Second, you should not ask any leading questions, but because that can lead to bias. Okay, and the third thing is you should not overlook the psychological things like anxiety. If the patient is feeling anxious, having pain, like all the non-verbal cues, pain, anxiety and all, we should not overlook that, because it will again become problematic later. Okay, practice these simple things and you will find that you are able to ace your history taking. Okay, and thank you so much for your watching. Mention in the comment what is the worst case history that you have taken, and also mention that most complex patient you have met till today. Okay, thank you so much for watching and staying. If you like this video, subscribe for more videos. Thank you.